As a mom now, I cannot imagine the pain my child and husband would feel to go through a Christmas without me.
Heather Langvass cried as she apologized at her sentencing hearing for involuntary manslaughter last September.
I pray for you all daily, and I hope that God gives you strength and solace.
The former nurse gave Megan Espinoza a fatal dose of drugs, including Percocet, ketamine, and fentanyl during a 2018 plastic surgery in Bonita. Vass, a registered nurse, had no formal training in anesthesia and broke the law when she gave Megan the sedation. The judge said Vass took advantage of patients when she pretended to be an anesthesiologist not once, but 100 different times. The day of Megan's surgery, Vass and Dr. Carlos Chacon left the mother of two dying on the OR table for hours.
The facts of this case, as I've earlier said, I don't think they could be more egregious. The victim couldn't have been more vulnerable.
The judge sentenced Vass to 2 years of prison. But as of June 1st, not even a year later, Team 10 has learned Vass is eligible to be released to community supervision. The state says she will be under the supervision of the county where she is released and would not tell us any other details. If the former nurse is let out on June 1st, she would have spent a total of 8 months and 12 days behind bars, not the 24 months she was sentenced to.
I feel kind of rage that this would be allowed to happen.
Megan's parents, David and Judith Gorsey, are outraged.
It's painfully inappropriate. That's the bottom line.
I don't think it's justice.
Not at all.
Both now have many questions.
How is that determined? And why wouldn't the victims be notified? Why wouldn't we know that she is coming up for release? We're thankful that we have you to inform us, because we certainly haven't heard from the state, from anybody.
I asked the state for an explanation. The Department of Corrections says incarcerated persons can earn credits to get time off their sentence while behind bars for participating in rehabilitative programming. The department claims people who successfully earn credits are not released early. They have served their sentence as defined by law.
My fear is that someone else will hire her before she is licensed again.
The Gorseys are concerned Vass could soon be working again. Although she no longer has a nursing license, she can eventually apply to get it back. Just last year, right before she went to prison, Vass was working at the San Diego Outpatient Surgical Center as a quality assurance coordinator. In a Team 10 exclusive, I reported on concerns from insiders at the center who claimed Vass was supervising nurses and getting involved with patient care, all without a nursing license. After our story aired, the California Board of Registered Nursing launched an investigation.
There's not one single day that goes by that we don't stop and pause and think about Megan.
Megan's parents are committed to keeping their daughter's legacy alive and don't think justice has been served.
We have a hole in our heart and in our soul that never heals.
I wrote Vass a letter and sent it to the prison she's currently incarcerated in to ask her for a response to this story, but I never got a response. Austin Grabish, Team 10.